It's the latest twist in the tale of 2020, as yesterday the Prime Minister announced the biggest tightening of rules since lockdown began.
As the confusion over the new guidelines continues, we're joined now by the Deputy Chief Medical Officer, Jenny Harries, to explain exactly what we need to know. Jenny, thank you for joining us this morning. Good morning to you. So we were all sat in front of our TV screens, listening, trying to pick our way through it. There's obviously a little bit of confusion again this morning. Different territories, different rules, it seems, and it's kind of trying to work out which ones apply to you. The big one, I guess, is the new rule will not apply, that the social gatherings for more than 6 people will be illegal in England from Monday the 14th of September, with some exemptions. And these are things like schools, workplaces, COVID-secure weddings, funerals and organised team sports. So just explain the kind of logic behind these exemptions, first of all.
Yes, thanks. So there's a really important message here, which is the case numbers in England are rising. We know that most of that is linked to social events, social gatherings. And so this is a very simple but hopefully effective way of getting a clear message over to members of the public so that we can all help each other keep safe as we go forward. So the basic principle is don't meet in groups of more than 6. And as you say, there are exceptions to that, and we can go through some of those.
Is this a case of you guys putting a cap on the young of the country because they are less likely to suffer severely from it, more likely to have got bored by now and say, listen, I want to see my friends? So is that what you're doing?
No, so the rules apply to absolutely everybody, all ages, no exceptions. The bit that you're referring to, of course, is that young people, and they have actually been very badly affected by this, perhaps not clinically, but certainly it's an age where you socialise a lot. So they have missed out in many ways from earlier parts of the lockdown. But we do have to try and implement some sort of social boundaries. But I think what we really should be clear is this isn't about, we're not back to keeping people in their homes and never going out. This is actually quite a permissive but controlled way and simple message, hopefully, of managing to retain a degree of normality while still managing to keep those case numbers down across the UK.
Why 6? Why choose the number 6?
Well, from a household perspective, I mean, whichever number you choose, it's problematic for somebody. So we know that's going to be a case. We have had larger numbers. Obviously, when you're in social settings, you sort of let your guard down. So, in fact, some of the most dangerous settings are large families meeting together across the country because there are no control measures around and you all know each other very well. So, but we also recognise that we can't say 1 or 2, which would be the ideal epidemiologically, because you're less likely to spread it. The number of 6 actually is the average, although it's a bit of a cliche, the average size of a UK family is 2.4 children. And if you look at a family meeting with 2 other people, so say a family with grandparents, the number 6 will encompass 93% of UK households. So I absolutely accept it's not going to be perfect for everybody, but it's always with COVID, this balance between the epidemiology, the risk, and trying to get people to, allowing them to have really quite as normal a life as possible.
Well, we broadcast to the entire country, and we don't want to just necessarily concentrate on just England. But the difficulty is that it is different wherever you go. In Scotland, up to 8 people from 3 households allowed to meet indoors, while groups of 15 people from up to 5 households are permitted to meet outdoors. In Wales, up to 30 people can meet outdoors, but people have been told not to gather indoors with anyone who's not a member of their household. Up to 4 households with an unlimited number of people also able to join together to form an extended household. In Wales, in Northern Ireland, 6 people from 2 different households can meet indoors, with groups of up to 15 people outdoors. What the hell's happening here?
So despite what you're saying, the absolute principles underlying that are still the same. So the key principles, and that's what we've put out also through the Hands, Face and Space campaign, is about limiting your social interactions, doing things more outside and not in enclosed environments, and keeping a social distance from people. So the underlying principles of all of the parts you've read out are the same. And I think it's very likely that you will see that different governments in the different UK countries, as these case numbers rise, and it's quite right that we're responding to those local rates in our local populations, actually do start to become simpler, if you like, across all of the UK nation. So certainly scientifically and medically, periodically the UK chief medical officers all meet, but translating that through to local populations and local countries can be a bit trickier. But I think we recognise, and that's part of the reason for doing the rule of six, is to get it as simple as possible as we move into this really critical winter period with cases rising and where people are likely to congregate more indoors.
I've got lots of questions for you, actually. Elaine says, can a child's birthday party happen if there are more than 6 children, but they're all from the same class bubble?
So, no, that's a class bubble is in a controlled school environment. And I think this is quite important for people to understand in looking at the new rules, if you like, because otherwise, as Phillip said, they'll all look as though they're not linked. But the principle is, if you're gathering socially, it's no more than 6. So if your child is having a party, and let's say you have a mum and the child, and you could have 4 friends inside, that's fine, but no more. But when that child is in a bubble at school, they are in a controlled COVID secure environment. And so what you will see from the exceptions will be similar sorts of things. So, for example, if you are in a workplace where it's COVID secure, the same will apply. If you're in school, there will clearly be larger numbers. But if you're gathering socially, when we drop our guard and we don't have somebody watching over us, if you like, to tell us to keep distancing, to put our, to keep washing our hands, put our face coverings on, then that's the area where we're seeing most of this transmission risk. So that's broadly the principle of the differentiation.
Joanne says, can you meet up with 5 people in one pub and then go to another pub and meet up with 5 different people?
So there's a technical issue about how you translate the word gathering, about intention. But I think the real practical point here is we would hope that people will try and limit the numbers of interactions that they have. It's really important. It isn't a case of trying to work around the rules. The rules are there to try and help us all keep safe, regardless of what age you are. And I think one of the important things is that although young people are predominantly the cases we're detecting at the moment, we know from other countries that these start to translate through into cases and hospital admissions 2 or 3 weeks after the peak starts to rise in young people. So it's really, really important that everybody does this. So if you're thinking of going off to the pub, you shouldn't be in a social gathering of more than 6. When you are in the pub and you should make sure that you are socially distanced from other groups of 6. So if there are 12 people hanging around a bar, the police will know that that is not an appropriate social gathering. And I mean, technically, you could switch your 6 as you come out of the pub and go to another one. But really, that is not what the rules are about. It's to try and keep us all safe. So stick with the people you know. The fewer interactions you have, the better. And keep socially distanced, regardless of where you are, whether you're in a pub, where you're going shopping or whatever it is.
You mentioned there the pub landlords, the staff, you mentioned the police, and I guess that's the next question here of how these rules are going to be policed. We know that marshals have been talked about, that they'll be drafted in to help ensure social distancing is maintained. Who are these marshals? Where are they all coming from?
And are they being paid £30,000 a year?
So you'll have to ask some of the policy colleagues. Clearly, I'm here as a medical professional, so that's not my bit of the system. But I think the important thing is about implementation, and I'm sure many of your viewers will have seen previously shots of large groups gathering in social environments, and I think actually that's quite frightening sometimes to people who perhaps are clinically more vulnerable, who haven't been out of the house very much, and are seeing these very large groups gathering and understanding there is a risk of disease transmission. So yes, the police will be able to implement this better because they will be able to see immediately whether there are more than 6 people gathering. So these large groups should be disbanded. And, if you're a pub landlord, for example, or landlady, you will know it's much clearer, I think, to your customers and to yourself what is and is not allowed. And it is about simplifying the message as we go into this critical winter phase.
Can I ask, the Prime Minister pinned his hopes for an end to restrictions on a Moonshot £100 billion mass testing programme, which we heard about yesterday. because you said that your area is medical and obviously not political, Chief Scientific Advisor Sir Patrick Vallance warned that the technology necessary for the so-called Moonshot scheme has not yet been proven in any country. Professor Whitty said he was confident the plan would work at some point in the not-too-distant future, but refused to put a precise timescale on this success. Does the Prime Minister say stuff that medically you guys slap your foreheads with your hands and go, how are we going to do this?
So I think it's fair to say the Prime Minister's ambition, exactly as he said, is an ambitious plan. But actually, we're in completely unprecedented waters here. And it's important that we do have big plans because the whole population is involved in this. And I think, importantly, the technology which is underlying that ambition is definitely there. There are testing apparatus, if you like, and numbers of them currently actively being tested, and very likely that they can be used quite quickly. Part of the difficulty between the technology and the implementation is just being clear what it would mean and how it would be used in practice. So many of the tests are not quite as sensitive or specific to disease as the tests that we encourage people to have if they have symptoms. This is a completely different set of interventions, if you like. And so it's really important that when it's implemented, people are really clear what their test means and what it means for populations in what they can and can't do. So I think the technology is there. That's and I'm sure it will be. It needs formally evaluating, but it's kind of linking the technology with the practical implementation, which will be quite challenging, I think, but nevertheless possible.
Just finally, Jenny, obviously, we're sitting in September now, and we've got these new rules, these new this new way of living again, a change to our lifestyles, and hopefully people will all stick with it and we'll drive those numbers back down again. What about Christmas? Are you guys cancelling Christmas?
Definitely not cancelling Christmas. Might be a different Christmas, just as the rest of the year has been. But I was watching your slot earlier on pressure cookers, and I think that's probably quite a good analogy. We need to keep the lid on the pressure cooker as we head into Christmas. And if we're all doing the right things, if we are washing our hands, using face coverings in enclosed spaces where we can't socially distance, and really sticking to these rules of six and increasing ventilation as well in our houses, but keeping into those small social groups, then there's a very real chance that we can manage to keep these numbers down. And if you do look across to places like France and Spain, they haven't put in interventions like this, and their numbers on a second wave have increased dramatically. Where Belgium, for example, has done so, you can see, if you look at the graphs, there's kind of flat peak, which says they've squashed it. So we need to keep the lid down and we need to squash the peak again.
All right. Thank you very much. Thanks for joining us this morning.
Thank you.